to invite our last panelist, and it's Kateřina Sirotková from the Czech platform for early care. Then it's Shoshana Chovan from Cesta in Slovakia. Marek for Schola Empirica in Czech Republic, who also helps the OMAMA project to evaluate their impact. And last but not the least, Milan Zbořil, representing the Banská Bystrica governing region. Welcome. I think, Katka, this is your mic. And you can come closer, so there is not a gap. Welcome in the last discussion. So we saw that you started a great project. So I will start with you, Katka. You started an incubator, as it was said in the video. Just can you tell us maybe what are the insights you see from the project? What are the outcomes we can see from the incubator in supporting interdisciplinary collaboration?
I would before this question, a little bit mention how was the support of holists at the first place, because that explains the way how we did it. Mm-hmm. And there were 3 very important ingredients. It was freedom to do the stuff we know what should be done, and the way we were supported to learn by doing, and to reflect on everyday basis. And there was trust. And all those ingredients we try to use the same way in those 4 regions, because those people who are from the region, they know what to do. They feel what to do. They just need a bit of fuel to do it, to happen. So that's what we mentioned. We used simple things like facilitation, professional facilitation, advocacy, consultancy, capacity building, and just support that they are doing great or their decision was right. Mm-hmm. Simple things.
Excellent. So Maxim, obviously this is how you build trust. There was the answer. So thank you for your approach. And it was duplicated by this project, which is really great. And do you see, where you are in the projects right now? Maybe tell us more. How is it going? How is it in these regions? And what are the outcomes? I know that this is just short time right now, but what can we see?
Okay. Each region pick up their own goal, what they were, facing, what was burning. For example, in the city of Plzeň, there were 40 kindergartens who were basically demanding some material stuff from all parents when the children wanted to enroll, which was fine with most of the parents, but with some, there was such a huge barrier that they were not entering the kindergartens. So the aim was, we just have to fix this practice, which is not right, and it actually happens.
Thank you for also the approach, which is important. Shoshana, you mentioned that the project, the fund supported the evaluation first of OMAMA program, so it can be scaled to other services and really become a system change. Also, tell us where you are right now, if the evaluation is over, maybe if there are some insights that could be valuable for others.
Yeah. First, I would like to say what OMAMA is, because not everybody has to be familiar with it. So OMAMAs are women directly from marginalized Roma communities who are very intensively trained, intensively mentored, and they are getting a lot of supervision to promote parenting skills, to promote stimulation of early development. And they work directly in the families, in the homes, or where necessary in other spaces. And because we have some experience, we have some know-how that we've gathered over the past 6 years of the program, and we see that it works. We wanted to gather as much information about what is it that makes it work, really, and what works in the program, but also what are some challenges that we still face. Because 6 years is not a long time. We're still learning. We all are learning continuously. And then take whatever we gather from the evaluation and use it in the process of advocacy for the new professional activity within the social service. Where we are at is that Schola Empirica has helped us with the evaluation. We're finalizing the report, so that should come out any day now, I think so. And there is a set of tips, advices, or some takeaways that can be useful not just for us, but for other providers of such services, or for the state as well. And that is one part of it. In the advocacy part of the project, our justification of why the services as such are necessary, or why this professional activity is necessary, has gotten into the conception of the Ministry of Social Affairs in Slovakia. So that's a small victory, but victory nevertheless. And we have very good communication with the ministry established, and we're happy to build upon that in next year.
Thank you. And Marek, as Shoshana said, you were involved in evaluation of OMAMA programs. So I have two questions. Maybe you can add if there are any insights that you think would be valuable to share right now from what you saw from that program that Shoshana introduced. And the second one, maybe if you can say us what's the overall impact of evaluation and measurement in early childhood development?
Yeah. If you don't mind, I would start with the first question, because I think it's important to note it as an overall framing, I would say. So we in Schola Empirica are always happy to assist with approaches that are very methodologically driven and rigid in a way, in methods. And we are happy that program OMAMA by Cesta is one of these examples. It's a long-term project or program that actually affects a lot of children, and it's very impactful. So we are happy to be assistant to such initiatives that are long-term. And about the evaluation and the importance is that actually when we work with such a sensitive target group as children are in their early age, it's always very important to be sure that we do not cause any harm, that we actually do something that is beneficial for the children. So we try to secure this by providing evidence, by scientific methods and rigid methods. So we are also happy that the program OMAMA is, or the evaluation of the program OMAMA is built on a very vast or rigid framework of methods and approaches. So we used from January when we started, we used quantitative methods, secondary data analysis, qualitative methods. It's a lot of stuff. Not to get too technical or something, just we interviewed a lot of people, we did a lot of questionnaires, and it's very, I would say, unique in our Central European region to have such a strong background in evidence and in science. So I think I merged the two questions into one, actually. So maybe I could just add about the insights or the things we found out is that there are some challenges, but overall we believe, based on the data we have, that the program is impactful, that it has its important role in providing early childhood development in marginalized Roma communities. So this is a very important aspect on our behalf, and we are looking forward to finish the report. And I think the results, if I'm not mistaken, will be public in a way, at least. So you can also take a look at the results once they will be finished. Mm-hmm. So, yeah.
We were talking about the importance of data in previous conversations, so it's really good to see that we can really innovate and collect data and find out how we can use the data. So I really appreciate it, and also that we can really innovate and try some experiments in the region as you did. And also what you did in Banská Bystrica with a map and visualization that we saw in the video. I think it's a very unique project for a regional government, and as I understand it, the goal was to find up some gaps, like in the services and how to coordinate them. So how do you use the map? And maybe what are the next steps for the map, and also the impact for the government? So how will you use it?
Actually, there was like a couple of goals we wanted to achieve, and yeah, like it's a very good tool for us in the regional government. Even we are regional government, we should know about our region. There's so many maybe things or problem or needs or issues we are maybe not so aware. It's also because we have some legal limitation what we can do and how we can do it. So we are quite happy that Hollis approached us with the offer to do such a project. It also gave us chance to try to combine different data we had or we had to look for on national level or with our partners and so on. So for us, as for the region or employees of the regional office, this is a very important tool that we can actually approach our members of regional parliament, talk to them and explain why it's necessary to maybe invest more money to certain ECD services or project. Explain them that it's not enough just to generally provide support for generally social services, but that there should be a very significant focus on ECD because our region is largest by size, but also by the number of municipalities. So it means that we have a lot of very small villages. So there is a lot of needs, but for those people, there are no services available. So all those data we've been collecting and we may have from the map help us to focus our policies, focus our money to provide better care for people or families, children they may need. So this is, let's say, one group of beneficiaries like decision makers, not only on a regional level, it can be also used by maybe lower level by the local mayors, as well as it may be used by the national governmental bodies. Of course, there are beneficiaries like directly families, parents of the kids. If they are looking for information, contacts, data, they can find on this map. And also we believe that this may also help maybe potential funders. So they can find out what is missing, where is a maybe chance to invest money to improve ECD, environment ECD services in our region.
Mm-hmm. Great. So thank you for your project, and we see that something is happening also really practical, what we discussed on the theoretical level in previous panel discussions. And there is no question, Maxim. There is no question, really. So I have a question. So maybe what are your hopes for continuation of the project, and maybe what is the vision or the next steps that you have? Like if you can summarize it very simply as a last round, it would be perfect. Katka, can you start?
Thanks for that question. It was mentioned in the video as well that we were actually looking for a tool, evidence-based tool, and we have chosen Pribokis, held by Isa, with great help of Michaela. And we have already started in Ostrava, Poruba, and other 5 cities are, let's say, deciding whether to go or not. But for me, this tool has everything what we were discussing today. It's the child in the center. It's driven by data. There is a strong political will, because without that, it's not happening, or we even wouldn't start ever. And it's also about quality. So everything at the same one place, one tool, but at the municipal local level. So my hope is that more cities will look for something like that, and they will put the ECD in the center, and we will see where it goes. We will have to learn by doing.
I will start my answer a bit differently because I forgot about one very important aspect of our project, and that is because the chair is empty because Vlado is missing today. But Vlado Matej from Socia Foundation is a very important partner in our project, and especially in the advocacy part of it. And I know he's watching today, so and I wouldn't want to forget about him because in the spirit of Places to Grow, this has been a very collaborative process. This entire, whether it's the evaluation part together with Schola Empirica or the advocacy part with Socia. So my hope for the future is now when the platform in Slovakia is established, we will move forward advocating together within the platform and creating the vision together as well. And another hope is that we will get general public on board in this topic, explaining how pressing this is, how it affects all of us, early childhood in general. And on a more practical level, what is the outcome of the evaluation is that we are going to revisit some of the measurement tools we're using currently and kind of adapt that. And look at how better we can empower the parents and their parenting skills.
Thank you. And Milan, for your project?
We started our cooperation by knowing that we should continue. So we are not going to develop the map for a year or two. So as we discussed within our office with the colleagues from educational department or analytical department, they're also looking forward and they are happy that we have such a tool and there is a commitment to continue because like services should continue, our office is going to continue, so we need this tool also for the future.
Maybe we're also thinking of the scaling the map to other regions and help other regional government to do the same project?
Maybe question for other governments, what happened during the preparation of, or during the project itself. We probably enlarge like the data. There was like set of data at the beginning we have been thinking about to like put in. By going through the process, we realized that we may need more information and so on. So on our level of Banská Bystrica self-government region, I think we may go deeper. So it means that we may maybe input more data and then find the correlation between different information, data, and so on. So definitely, this is the one way how we can continue, how we may use in the future. But yeah, if some colleagues from other regions like the map, I guess we would be happy to share it.
Perfect. You're open to share your vision and your solutions so it can be spread. Thank you for your project and also your time to be here today with us.
Thank you.